It is now my pleasure to introduce Secretary Mandy Cohen. Since being appointed as Secretary of the Department of Health and Human Services in January of 2017, Mandy Cohen and her team have worked tirelessly to improve the health, safety, and well-being of North Carolinians. Among her top priorities are combating the opioid crisis, building a strong, efficient Medicaid program, and improving early childhood education. Before coming to the North Carolina Department of Health and Human Services, she was Chief Operating Officer and Chief of Staff at the Centers of Medicare and Medicaid Services. A graduate of Cornell University, Secretary Cohen received her medical degree from Yale School of Medicine, a master's in public health from the Harvard School of Public Health, and trained in internal medicine at Massachusetts General Hospital. Please join me in welcoming Secretary Mandy Cohen.
Good morning. Well, thank you, Cindy, for that kind introduction. And while we figure out getting is it up on the screen? Okay. Hold on. All right, we're just not going to use this one. Okay, so good morning again. Before I jump in and get started on the vision that we have for early childhood education, I just wanted to start by saying about how I came to learn about Smart Start. So I had actually never been to North Carolina before I came down and interviewed for this job, but I had heard about North Carolina, and I'd heard really, really good things. And so I had been mentioning to a couple of my friends in the DC area, hey, I'm thinking about North Carolina, and I mentioned it to my friend Lauren Lycan, who is the policy director for the National Association for the Education of Young children. Oh, see, there you go. Thank you. And she goes, ooh, I love North Carolina. They have such good early childhood bones. Do you know about Smart Start? Right? Those are her first 3 sentences. Ooh, I love North Carolina. They have good bones. Do you know about Smart Start? And that started my journey of learning about Smart Start. And then I had the exceptional good fortune to meet Susan Perry Manning, who is here with me, who is my Deputy Secretary of Human Services. I'm going to embarrass her. Who was a leader here in North Carolina with Smart Start before, she left her home and went to Delaware and to DC. We are so glad she is back here in North Carolina and just doing such tremendous work. Being my teacher, but really being the visionary behind how can we move forward in terms of early childhood health and education. And so I'm excited to share with you about what we plan to do, but really I wanted to first talk about those bones, right? This is what my friend Lauren was really talking about, and the congratulations after 25 years of amazing, truly visionary work. And I want to echo where we just ended about thinking differently. If you think back 25 years of the vision of what this was, to think about young children and their families holistically, right? Not just about health in a silo or education in a silo or about nurturing in a silo, really about children and families in that holistic way. It is something that you're gonna hear as a theme throughout all of what we're trying to do at the department, but you should really be congratulated on how much has been accomplished, whether it's just showing that kids who had exposure to Smart Start, having higher standardized reading and math scores, whether it's making sure that we're increasing the quality of childcare here and increasing star ratings from somewhere in the 2s to now almost nearly 5 as of last year, leveraging $40 million a year and really making those dollars go really, really far, supporting quality improvement activities, and then focusing on health and nutrition best practices, making sure we're the kids in North Carolina are screened and are ready to come to whether it's pre-K or kindergarten, ready to learn. It's exciting to be here on your 25th anniversary, and you should be really proud of where you're starting from. And I'm hoping the things we're going to be talking about that we're doing in North Carolina only further the vision and mission of what you've been doing. So it's not surprising, and as Cindy mentioned in the opening, okay, hold on. Here we go, that we're focused on 3 areas, and they all touch the lives of children and families. But we call out specifically one of my priorities, and I'll spend most of my time on early childhood health and education. But I want to touch on the other 2, Medicaid and the opioid crisis, because they're really important topics that we're spending a lot of time on. And in Medicaid, as you may know, we cover 1 out of every 5 people here in North Carolina, so there's about 10 million people in the state. We cover 2 million people. Most of those on the Medicaid program are children. We cover about 1.2 million children. We pay for half of the births here in North Carolina. So a big lever here in the Medicaid space, and it's about to undergo a very big change. Right now, we have a state-administered Medicaid program. Means like if a kid sees a pediatrician, the state pays the pediatrician directly, pays the bills directly. Starting as soon as next year, we're going to be moving to a system of managed care where the state will be contracting with insurance companies to pay those bills. Now, that was a decision that was made before we were here, and my goal is to make this implementation go as smoothly and use this as an opportunity to really think differently about the program. And when I think about it, I want to make sure that we recognize and build on the things that are working really well here, and I think there's a number of them, as well as learn from other states that have moved to managed care before us. We are the largest state that has not moved to managed care in their Medicaid program, so we have a lot of good examples and some bad. Avoid those bad things, learn from the good, to bring here to North Carolina. And the 2 themes that I will leave you with, I won't go into a huge discussion about all of the policy, but there's a lot out there if you're interested. The 2 big themes are really, 1 is a focus on the whole person. Right now, we have a pretty siloed way of paying for care and thus delivering care. Right now, we pay for physical health very differently than we pay for mental health, and sometimes, and then very, very differently than we think about all of the unmet social needs that are out there. And what we're going to try to do as we move forward with this transformation in Medicaid is to bring all of those pieces together and have one entity thinking about a person, a family, a community. Right now, I think in healthcare in particular, we get what we pay for. We pay for doctor visits, we pay for hospitalizations, we pay for drugs. We get those things. We get really good care here in North Carolina, some great hospitals. I know Terry Aiken was here from Cohen before. But we have to start thinking differently, and this is where the drive to value comes in. We have to, if we want different results, and I do, I want the best health for North Carolina. I don't want just the best health care, I want the best health. And that means thinking differently. I don't want to just buy hospital visits, I want to buy health. And to do that, we have to use those payment levers to think differently, and that means buying value and driving to value. So it's not just saying we're going to put all this money together in one pot. It's going to say, I have different expectations of what I want to get for my money in the Medicaid program, and this is thinking about advanced medical home and investing in primary care and getting care as local, embracing the localism, getting care as local as we possibly can to folks. And so we know we need a lot of support through that transition. So those are the 2 major themes. And then let me tell you about some investments that we're making overall to address what folks are referring to as the social determinants of health, but which you in this world would say, that's just my job, right? That this is not a new concept of really thinking holistically about a person, because we know that kids can't learn if they show up hungry, that they can't get well if they don't have housing, and they certainly can't, mom and dad can't be successful if they can't get transportation to their job or to childcare or others. So we know that we have to think broadly, and this is how we are thinking broadly at the department. So one is first, right now up on our website, might be useful to your local organizations. We have what we're calling this hotspot map, but down to the census tract level, where you can see where in your communities are the food deserts, where are folks really lacking access to transportation transportation? Where are folks paying more than 30% of their income for housing? So there's a lot of really rich information in there. It doesn't solve any problems, but I hope it will help you target some of your resources as well as spur conversations about what's going on in various communities. Second is that we have to actually ask about folks' unmet social needs, whether it's about housing or food or other. We have to do that no matter what door they walk in, whether it's your door, a pediatrician's door, the emergency room door, our social service door. Ask questions about housing, food, because we know that's what builds health. And so we've just completed a process around standardized questions here in North Carolina. It's out for public comment right now. Tried to really make it slim, just 8 questions that we could administer really in a lot of different settings. So take a look at that. The third is a new endeavor that we're going to be taking, and I'm hoping to announce later this week, about building a resource platform, again, to help, frankly, do what a lot of you do in your organization, right, is knit together the resources in your community. Right now, I feel like the health resources and the health systems live very separate lives, if you will, than what's going on with some of our community resources. And could we create a platform that starts to knit them together? So, and it's not just a, hey, know about each other, but actually do true referrals. So you can imagine a patient would come into my office. I'm a primary care doctor. We administer the screening questions. We find out that my patient is running out of food at the end of the month. And then what we would do right then is literally write a referral, as if I was doing it to a specialist, but write a referral to the local food bank, maybe down at the local church or other. And then when we send a message to that local food bank saying, hey, Mrs. Jones is coming your way, if she doesn't come in, say, 2 weeks, let us know. Because I don't want to just refer. I want to know that she actually got food, because that matters to her health. And we were able to create these closed-loop referrals. So it's an ambitious project that we're going to try to do across the entire state. It has been done in pockets, some here in North Carolina. We're learning a lot from other states on it. And then lastly, we're going to try to be doing a couple of pilots to really learn about how can we intervene and use healthcare dollars, again, to drive better health. Terry Aiken may have talked about one of the projects that we are building upon is something that was piloted here in Guilford County with Cohen Health for asthmatic children. Kids with asthma, with severe asthma, often wind up in the emergency room. Where's the most expensive place to get care? The emergency room, right? So bad outcome overall. They're in the emergency room. They're spending the most money. Mom and dad are not at work because everyone's sitting in the emergency room. So what they decided to do is let's think differently here. Let's go to the kid's home. Let's rip up the carpet, put down new carpet, right? Because we know mold triggers asthma. Let's put down new carpet and give them an air filter, and let's see if that makes a difference. And not surprising, almost nearly immediately, the number of emergency rooms visits dramatically dropped. So we're spending less money, the kids are healthy at school, learning, mom and dad at work, right? Win, win, win. So I want to understand what are those other types of, whether it's a housing intervention or a food or a transportation or something related to interpersonal violence, what's the next carpet? What's the carpet I can buy for folks who are at higher risk of bad health outcomes? And how can we think about investing? So when I say I want to use Medicaid dollars to buy carpet, that's what I mean. I want to buy carpet in service of good health. So that's a bunch of what we're doing in the Medicaid program. Let me touch on the opioid epidemic. As you know, this is something that's gripping many, many communities across North Carolina, and it's not surprising that it is worse here than in other states because we have a higher uninsured rate, so more folks are not able to get access to care. And what you can see in this graph that's on the right-hand side is that really giant spike in blue. And that's the number of deaths that's really skyrocketed in the last 2 years. We're going to be putting out 2017 data soon that's going to show that we're going from about 1,300 deaths to 1,600 deaths, and then we're really going the exact wrong way. And we have now moved this epidemic from one of pain pills of OxyContin and Percocet and Vicodin to heroin and fentanyl. that's what is really driving up the number of deaths that we're seeing. And it is having a major, major impact on our families and frankly, the programs that we run out of the department related to foster care in particular, but also, as I mentioned, we pay for half the births in the state. We're seeing a 900% increase in children exposed to opioids in utero. That means for a lot of them, NICU stays when they wouldn't have had it otherwise. And I've toured a number of hospitals who now have had to set up separate wings of their NICUs because the babies who are exposed to opioids are so irritable. They cry so much because they're in pain, they're withdrawing from pain medicine, that they're actually were disturbing the other little newborn babies, so they needed a separate wing. That is the absolute wrong direction that we want to go, and we need to get folks into treatment and really get upstream from this work. And we're seeing an already strained and nearly breaking mental health system now take on this opioid crisis, and we're seeing our community services really, really get to the breaking point. So we need to think differently. We've done a lot of work to date. There's been new legislation that has really seen a pretty dramatic curb in the number of new starts of opioid medicines, which is great. We've changed some of our rules in Medicaid to make sure we're thinking about other pain medicines, because pain is real. We have to treat pain, whether it's with physical therapy or acupuncture or others. We've also purchased naloxone kits. That's the medicine that reverses opioid overdose, and we've purchased 40,000 of them and sent them around the state. We've gotten nearly 4,000 folks into treatment with grant funding, but again, grant funding is a Band-Aid. We need folks to have access to insurance to treat their chronic disease of addiction. So, right, they need insurance for the rest of their lives. And we have a tool that we are not utilizing right now here in North Carolina. It's called Medicaid expansion. And unfortunately, that's gone into a very partisan place, and it doesn't need to be. But we need this tool back in our tool belt so that we can work to fight the opioid addiction. Thank you. So let me then spend a bit of time on what we're working on specifically in the area of early childhood health and education. But as you can see, what we're doing in Medicaid, the work we're trying to do related to the opioid crisis, very much a part of this. And I don't need to tell this room about why. Why would this make it into the top 3? You should question me if it didn't. But Susan was the one who convinced me that it should go in the top 3. And it's not just about the return on investment, which we know, but it's really, to me, grounded in the science of the foundational brain science of the future learning, health, and well-being that is established in early childhood. These are things you probably know very, very well about how the brain actually develops over those first 5 years. The exact age that you are targeting, whether that's synapse formation and then the pruning, is really important. But we also know that toxic experiences, trauma during this time, actually breaks those synapses and actually really changes the way in which your brains are acting. So we know that adverse childhood events are something, or adverse childhood experiences are things that I don't think I was as aware of as a primary care doctor, right? I'm treating diabetes and heart disease and obesity, and I didn't really even understand how intimately it was linked to trauma as a child. And we know that we have a lot of work to do. Here in North Carolina, we rank 30th, where we're seeing 24% of kids experiencing 2 or more traumatic events. And we know that those higher ACE scores means worse physical and mental health issues overall. So where are we in terms of overall kids' well-being? You can see we generally rank in the 30s, and there are some of those statistics that I want to highlight for you. But it's a testament to you, the second one down here, despite the fact that 62% of kids are still reading below proficiency at 3rd grade, ranks us 15, and that's a really impressive statistic if you look at all of the things that are stacked against kids, unfortunately, in North Carolina related to poverty and food insecurity. That's a real testament to the folks really in this room and the work that has been done. But as you can see from these statistics, we have a lot of work to do to think about the overall well-being of children. And at our department, we are very, very lucky in that we have a lot of levers and a lot of tools and a lot of ways in which our department reaches young children. Like I said, the births in the state, that 172,000 are served through WIC, 110 through SNAP. Kids 0 to 5 are in licensed child care programs. And that about 40, I'm already out of time, so I'm gonna speed up. So you can see we touch the lives of kids a lot. And so what we're in the midst of doing is developing an early childhood action plan around 3 domains: kids being healthy and safe, making sure kids are nurtured, and make sure that they're learning and ready to succeed. And so let me touch on the 3 ways in which we're thinking about that. In health, we've already touched on the problems related to some of children's health. We need to close that insurance gap. We're thinking about our Medicaid transformation work, and then also need to think about that important link between food and health. And we have really big tools at our disposal that we can use in the WIC program and the SNAP program. And so you'll see us do more targeting to make sure that folks are taking advantage of the support that they can get. Second, around children's safety, right, the opioid crisis we know is swelling the rolls of foster kids. But we also have some really important work, like I said, around the opioid action plan, but we also are undertaking a look at reforming our delivery of social services and child welfare across the state of North Carolina. We have working groups going on, we have legislation that was passed, we have consultants that are coming to help us learn from best practices around the world, and also thinking about how do we do trauma-informed care and trauma-informed services as we go forward. And then the last is around early learning, which is where the department really has a lot of tools and has been doing great work to support expansion of pre-K, expansion of Smart Start. So we've increased the number of slots around pre-K. We've supported additional Smart Start funding, and we've been increasing the child care workforce supports, and as well as the child care subsidy supports. What I'm very excited about, and who would have thought, coming our way is going to be the largest increase in our child care development block grant that we've had in many, many years. I think all of us, when we are very much at the department thinking about how do we not let this moment pass us by, and think about how do we really use the dollars that are coming from this investment in this block grant funding and use it to really drive forward the health and well-being of the children and families here in North Carolina. And it's not going to be surprising that when you see how we are thinking about it, it's going to be a mix of things that involve health, safety and nurturing, and ready to learn. And so whether it's about family resiliency and investing in children and child care subsidies and making sure they can not only have slots, but we can support you all in the administrative costs that you have to run important programs. So I hope you will take a look at the governor's budget and how we're moving forward with that. But before I turn over to other folks, I just want to let you know that we are putting together this action plan. We have this draft vision that all North Carolina children get a healthy start and develop to their full potential in a safe and nurturing families, schools, and communities. But we need your help to make that possible. And so we know we can't do it without you. You have a legacy of really delivering for the children and families here in North Carolina. We know you're already focused on accountable population outcomes, and we want this action plan to be extremely metric driven. We want this to be a public-private partnership model focused on whole child and whole family, and we know your history of success will make us ultimately successful as well.